And I'm going to turn it over to Guerren Solbach, who his reputation precedes this, and so many of you know it. So we look forward to your presentation. Thanks, Guerren.
Thanks, Julianne, and thank you to the Retiree Center that makes this so much easier for me. I mean, back in the old days, before we had Zoom, I can remember spending inordinate amount of times renting rooms, trying to find funding to rent rooms, trying to advertise, and the Retiree Center really makes things easier for me now. I really appreciate you. So my name is Guerren Solbach. I'm the healthcare facilitator for UC Davis, which means that I'm one of a two-person program that specializes in troubleshooting the use of UC health plans. Our program serves employees and retirees, and we do a little bit of dental and vision, but mainly our time is taken up troubleshooting the medical plans. We do a lot of Medicare coordination as well. So if you are approaching age 65, or you have a family member who's approaching age 65 or is otherwise eligible for Medicare, call me. The best way to reach us is by phone. You'll have our contact information at the end. My web address is listed by my name in the little Zoom window here. So you can always go to my site and get all the contact information you need there. Before we get into open enrollment, though, I want to mention that we have some news for the healthcare facilitator program here locally. First of all, congratulate me. I have another healthcare facilitator helping me now. I am no longer by myself like I was last open enrollment. I'm very happy to report Nick Robledo is the new healthcare facilitator for UC Davis. I'll go ahead and let Nick say hi for a moment so you can get to know him a little bit.
Hello, everyone. Thanks for that, Guerren. I'm very excited to join Guerren and helping you guys out. It's been a good experience so far, and I really look forward to helping all the retirees. The best part of my job is to be able to interact with all the retirees and all the employees as well. It's very nice. So feel free to give me a call if you have any questions. If I can't figure it out, if I don't have the answer right away, I'll figure it out for you. But please feel free to give me a call. I look forward to meeting all of you, or most of you, and working and creating new relationship with you guys. So thank you.
Very nice. Thank you, Nick. Now, there are 10,400 retirees from UC Davis who are eligible for health benefits. So we are very busy right now because it's both employee and retiree open enrollment. But reach out to us. The easiest way to reach us is by phone. I am routinely very behind on email because I get so much of it. But by phone, I'm usually, within a few hours. Right now, I have almost 50 unheard voicemails, but that's because it's the beginning of open enrollment. We will catch up eventually. Everything's going to be okay. But some other news for our program: we have moved to a permanent location at 1333 Research Park Drive in Davis. This is my new office. I have windows. I have an air conditioner that works correctly. It's amazing. I really like it here. But there isn't a lobby. So if you come to this building, make sure it's by appointment. Make an appointment with us, call us from the parking lot, and we'll come fetch you, since there's no lobby for you to sit in and wait for us to navigate to the entrance to the building. But it's right off of Richards Boulevard, very convenient location, not too far from campus. And most important to UC Davis, I don't think UC Davis is paying rent for this place. UC Davis actually owns the Research Park Drive facilities. So it's a win-win. I'm very happy with this location. All right, let's talk about open enrollment. The first thing I want to say about open enrollment, before we even talk about dates and details, is that you may have heard a lot of noise about Anthem Blue Cross plans and UC Health. There is a contract issue going on between Anthem Blue Cross and UC Health that if they don't resolve the issue by the end of February, people who aren't affiliated with UC may be affected. But you and I, UC employees and retirees, are not affected by this contract issue because there is a separate contract between the Anthem Blue Cross and the University of California. The only exception to this is if you're a medical resident in an HMO. That's the only exception. I doubt that there are any medical residents on this Zoom right now, so you can essentially disregard the Anthem news. If you are somebody who is triple covered by UC, CalPERS, and Medicare, then you might have an impact through your CalPERS plan, but because you have coverage through UC also and Medicare, you're sitting pretty. You do not have to worry about the Anthem contract. So ignore the Anthem contract. It's irrelevant to you. But open enrollment this year began on Thursday, October 26th at 8 a.m. and it will end on Friday, November 17th. That's the Friday before Thanksgiving. I know that open enrollment used to end on the Tuesday before Thanksgiving, but they've changed it recently. It is ending on the Friday before Thanksgiving at 5 p.m. These days. So I want you to know that there are almost no plan changes for 2024. Almost none at all. Literally, hardly any change whatsoever. But there are changes to the rates, which we're going to talk about. The rates are the big news this year. We'll get into more detail momentarily. If you do decide to make a change, then you need to sign into UC Raise if you have computer access. If you're on a Zoom right now, I suspect you have computer access. So make your changes using UC Raise during open enrollment. And during open enrollment, if you wanted to call the retirement system, they have extended hours. Only during open enrollment, they start taking calls at 7 a.m. and they take calls until 4:30. The way you reach the RASC, the Retirement Administration Service Center, is to call 800-888-UCOP, as always. So there are almost no plan changes at all. There are always, however, every year, some minor changes to Medicare Part D, D as in drugs. This year, there are some more interesting changes to report than normal. You may remember that the Inflation Reduction Act came out last year, and it does some very nice things to Medicare Part D. It improves Medicare Part D, as in drugs, in a big way. For 2024, the Inflation Reduction Act is going to eliminate the 5% that people who have regular real-world Medicare Part D plans have to pay after they reach the catastrophic stage of Medicare Part D. Now, unless you're covered by VIA benefits and have real-world Medicare Part D plans, you probably weren't even aware that there was a 5% because you wouldn't pay it yourself anyway. But the fact that Medicare Part D is eliminating the 5% should slightly reduce our premiums. That's my expectation anyway for 2024. Many other events have dwarfed that tiny benefit when it comes to rates. We'll talk more about rates in a moment. But more exciting than 2024 is 2025, because in 2025, a $2,000 cap on out-of-pocket costs is being mandated by Medicare Part D drug plans. Now, that is a big deal. You and I know that your Medicare drug coverage through UC is quite good. It's amazing. It's much better than you could have out in the real world. And if you have friends or relatives that have real world Medicare Part D plans, there's a deductible that they have to meet, and they have to pay 50% up to a certain level, then they pay 5%, et cetera, et cetera. It's not what you're used to through UC. So the fact that this is improving is good because it theoretically will help with our rates for 2025 when this $2,000 cap, this out-of-pocket maximum, will be implemented. Now, the reason I bring all this up is that many of you that have Medicare already have out-of-pocket maximums on your Medicare Part D drug plans that are nice and low. I mean, if you have high option, you have a $1,000 out-of-pocket maximum for drugs. If you have UC Medicare Choice, you already have a $2,000 limit on what you pay for prescription drugs, et cetera. But there are a couple of plans that have TROOP as the out-of-pocket maximum. TROOP, T-R-O-O-P, which is a Medicare Part D term that means true out-of-pocket maximum. So if you have the UC Medicare PPO plan, or you have Kaiser Senior Advantage, you may be aware that every year your out-of-pocket maximum for drugs goes up, but I'll bet you've never noticed it affect you. Why? Because our people in our plans, our custom Medicare plans for the University of California retirees, no one spends all the way up to the true out-of-pocket maximum. I think the true out-of-pocket maximum is $7,200 this year. Next year, it will be $8,000 or something like that. I don't think any of you have ever spent that much ever on drugs, because our plans are so rich that between what you pay with your little piddly co-payments, plus what your plan is paying for your drugs, if you even take very expensive drugs, the plan is spending so many thousands on your drugs that you stop paying once the troop is reached, even if you are not spending the entire troop yourself. So, for example, I know people that have the UC Medicare PPO plan that take Enbrel, and the $8,000 prescription drug out-of-pocket maximum, the troop, looks scary to these people, but they end up spending maybe $300 a year on prescription drugs because their little co-payments of $30 for Enbrel, a $2,400 a month drug, they're spending $30, but the plan is spending $2,400. So after a few months, between the plan and spending thousands on drugs and them spending maybe a few $100s in co-payments, all told, they're done paying for the rest of the year. So the coverage is even better than it looks. And all the plans, theoretically, in 2025 will have $2,000 limits on what you pay for prescription drugs anyway. So it's all good news. Now, if you didn't understand everything that I just told you, that's okay. Medicare Part D real world coverage is very complicated. The troop makes little sense to normal human mortals, but just trust me, the coverage is great through UC and it's getting even better. When it comes to prescription drugs for our custom Medicare Part D plans, and if you're covered by real world plans through VIA benefits, this $2,000 cap coming in 2025 is very welcome news. This is fantastic news for our people who live out of state and have VIA benefits coverage. Okay, now let's talk about the premiums. Okay, this is the big news. This is the slide to pay attention to. I really appreciate you being here today because I'm hoping that not too many people just snooze through open enrollment this year, because I don't want you to be shocked by medical plan premium increases in January. Now, on your left, we have the non-Medicare plans. On your right, we have the Medicare plans. Okay, first, the non-Medicare plans. If you have core, your premium is remaining flat. No big deal. You're going to pay the same next year as you are this year, most people anyway. If you have Kaiser, though, if you have non-Medicare Kaiser, your premiums are going up by 22%. Now, this is going to vary how it actually affects your net paycheck on January 1st. Is going to differ between retirees because some of you may not be eligible for 100% of the UC contribution. Some of you may get 50%. Some of you may get 75%. Some of you may get 30%. It depends on, many variables. It depends on what percentage of the UC contribution you get. But based on a single person getting 100% of the UC contribution, that 22% increase translates to $42.53 a month. So that's a noticeable increase to your premium, $42.53. And of course, you can calculate your rates on my website in more detail, but this is the big picture. For people in Health Net, the UC Blue and Gold HMO, your premiums are going up a little bit, but not too bad. 9% isn't so bad. You're looking at a premium increase of about $24.66 per month, which in the scheme of things isn't that bad. Compare that to UC Care. If you're in UC Care through Anthem Blue Cross, your rates are going up 17% or almost $60 a month. $60 a month. We've never had premium increases this shocking. And, for months, UCOP has been warning us that every medical plan that we contract with has been coming at us with double-digit premium increases. It's just terrible. UC budgets 4% to spend each year more on healthcare premiums. In addition to the 4% that UC budgeted, UC threw an additional $9 million on top of that to try to keep the premium increases from being too ridiculous. And they're still this bad, even with the extra $9 billion thrown in. It's shocking. And I'll say in a few minutes, I'll say a little more about why the premiums are going up. But take a look at this next one. Very few of you may have this plan because this plan is not offered to retirees. But employees who retire with the UC Health Savings Plan through Anthem Blue Cross, they are seeing premium increases. Their premiums are more than doubling. A 106% increase translates to $178 a month more. That is shocking. I have never seen premium increases like this. And I would like to point out that I am in this plan as an employee. I am in the UC Health Savings Plan. And for my family, my premium is going up $344 a month. That's like a used car payment. So I'm still trying to wrap my head around these terrible premiums. Now, in particular, the UC Health Savings Plan had the worst premium increases because we've been told this multiple times because of multiple super high cost claimants. So I don't know if that means there were multiple preemie babies in neonatal ICUs for 6 months, or if we had, multiple bone marrow or kidney transplant patients in this plan. All I know is my premiums are going up a lot. And if you're in this plan, you have my sympathy. I share your pain. But now let's talk about the Medicare plans. If you're in Kaiser Senior Advantage, you're doing just fine premium-wise. Your premium is actually going down a little bit by about 2%, which translates to about a little less than $3 a month. So pretty much flat for Kaiser Senior Advantage members. But watch out if you have high option. If you have the UC high option plan, the highest premium Medicare plan offered to retirees, you're looking at a 48% premium increase, which translates to an increase of about $102 a month. $102 a month for high option. These are shocking premium increases. In contrast, if you happen to be in the UC Medicare PPO plan, which is a plan that's very, very similar to UC high option, but it costs less. Well, it's going to cost even less next year. Your premiums are actually going down by 22% if you're in the UC Medicare PPO. So congratulations to those in Kaiser Senior Advantage and the UC Medicare PPO. You dodged some bullets there. Now let's talk about the UC Medicare PPO without prescription drugs. That plan is a very special plan, only offered to people who are triple covered. So these are people who have UC, they have Medicare, and they have maybe TRICARE for life through the military, or they have CalPERS coverage through their spouse. If you're in the UC Medicare PPO without prescription drugs, you don't have drug coverage through UC because you have it elsewhere. Okay, so very few people have this plan. If you're in that plan, the premium pretty much staying the same. It's going up by about 3%, but it's staying pretty flat. Now, many of you have the UC Medicare Choice Plan, our newest PPO through United Healthcare. That plan is going up 75%, I am sorry to say, for next year. This translates to an increase of about $63 a month. Again, shocking, unprecedented premium increases for next year. So I am very sorry for you if you're in the health savings plan, UC Medicare Choice, or high option. Those are the plans with the most brutal premium increases. But again, thank you for attending today and not just snoozing through open enrollment so that I could warn you about these things. Because when you get your open enrollment booklet in the mail, you may not necessarily be comparing this year versus the previous year. So you may not see this hit to your pension check, coming. I don't want this to be a surprise. You need to understand in advance what's happening. I also want you to know that the biggest reasons that we've been told for these premium increases, which by the way, are not just happening to the University of California. This is happening to lots and lots of employers all over the place. State of California employees also had just massive premium increases, as I've been told. But the medical plans are telling us that these premiums are increasing so dramatically, mainly because of the pandemic. So many people put off medical care during the pandemic because it was difficult to get care, because of all the lockdowns, because of all the masking, et cetera, et cetera. A lot of care was put off. Now people who didn't get care during the pandemic, they're worse off than they would have been before. And now they're hitting the system really hard at a time when a lot of medical professionals have retired to get away from the stress and danger of the pandemic. UC Davis Health just put out a study last week that showed that they did a study that showed that 13% of cancers went undiagnosed just at UC Davis Health because of the pandemic. And that's 13% of their patients whose cancers have progressed further than they would have had those cancers been caught earlier. Well, that's just one example. One health system, just cancer, 13% of their diagnoses were missed for a few years, and now everybody's trying to catch up. So that's the biggest reason for the double-digit premium increases across all the plans. Obviously, UC has been able to absorb some of it, but not all of it. Another reason that is we're always told the premiums go up is bad claim experience, which would be the UC Health Savings Plan for sure. Bad claim experience means if you have a lot of high-cost medical claims, those are passed on to you in the form of premiums the following year. And of course, UCOP always points out that new prescription drugs that come out, pharmaceutical manufacturers who come out with a new FDA-approved drug, they can charge whatever they want during their patent protection, which lasts for a long, long time. All of these costs are passed on to us through premiums. And all these health systems are struggling to recruit and retain employees. I mean, there was a primary care physician shortage long before the pandemic, right? Well, it's very difficult for all these health systems to recruit and retain right now. And all the money they're throwing at providers to keep them and attract more providers, all those costs are passed on to us. So that's what's going on. This is the big news for open enrollment for 2024. Speaking of premiums, we can't forget that Medicare, for those of you who have Medicare separately, Medicare premiums are separate and paid for by you, right? By retirees. UC has no way to pay your Medicare premiums, so I don't want you to forget about those. They are going up by about $9.80 a month next year. The standard Medicare Part B premium in 2024 will be $174.70 per month, more if you're super high income. Now, if you are high income, I want to point out that they did increase the indexing on the high income premiums. So I think that your high income next year, you're considered high income if your adjusted gross from 2 years ago is above $206,000 for couples or $103,000 for members filing singly on their taxes. So that increase in what they consider, who they consider high income may help you, but just be aware of that. Premiums are going up for Medicare also. Now, when it comes to open enrollment for UC for 2024, again, open enrollment ends the 17th, Friday the 17th, before Thanksgiving. It ends at 5 p.m., not midnight. If you didn't get a booklet in the mail, you should have. They started mailing those on October 19th. If you didn't get your booklet, you can find them on my website. I linked to the booklets there. Now, if you wanted to make a change during open enrollment, the fastest way to get to UCNet for open enrollment is to go to ucal.us/UCNet. You can also use the internet shortcut for the open enrollment subpage, which is ucal.us/OE. Either way, that gets you to UCNet, lets you sign into UC Raise. It gives you links to UC Raise so that you can sign in and make changes for 2024 if you need to. Now, if you do make a change by 5 p.m. on Friday, November 17th, you're going to use UC Raise. You're going to elect your change, but you want to make sure that you get a confirmation number. If you didn't get a confirmation number and a confirmation statement in your UC Raise messages, then you didn't achieve anything. My understanding is that these confirmation statements, they do not go to your email. They go to your UC Raise messages. So do what you want to do with open enrollment. Then after you're done, go check your UC Raise messages. And if you don't have a computer, you're probably not on this Zoom, but you can call 800-888-UCOP. You can call the RASC to make changes over the phone. Always remember, when you're making an open enrollment change, that change is not effective immediately. It's effective January 1st. It's always effective the following January. And if you have Medicare and you're changing between Medicare plans, you will very likely have Medicare paperwork that you'll need to do. Paperwork where you have to sign and attach a copy of your Medicare card. That paperwork is due November 27th. The best way to submit that paperwork is by fax. I know it's 1970s technology, but due to limitations of the retiree database, it is difficult for them to get forms by upload, difficult by mail. Fax is the easiest way to do it. You can get to a fax machine at FedEx, Office Max, Staples, UPS stores, PDQ, Kinko's, etc. Make sure to keep your confirmation page. The fax number is right on the forms. And you should get an email from the RASC within a week or two of faxing the forms in. If you don't get an email saying, hey, we got your form, you may want to follow up with the RASC and make sure that they got your form. Give them a call and see if they got it. As always, this is always true, yet I still get calls from people. Do I have to do anything during open enrollment if I'm not making a change? The answer is yes. If you like what you have and you're not making any changes, as always, you don't need to do anything. I like to say that during open enrollment, you don't need to do anything except read your open enrollment booklet, just in case there's something in there that might prompt you to reevaluate something. But I also want to point out that this includes UC Health Savings Plan members who will be 65 next year. So the UC Health Savings Plan, remember, this is that plan with the highest premium increase, sadly. That plan is not offered to retirees because it's not compatible with Medicare. And that's because the plan has an HSA associated with it, a health savings account. And the IRS doesn't let you contribute to a health savings account if you have Medicare. So we don't offer this plan to retirees because as soon as you get Medicare, you have to change plans. But this means that I have to give you what is essentially your own personal open enrollment if you have the UC Health Savings Plan and you or a covered family member turn 65 next year. So as always, what you should do as you approach age 65, or if you have family members who are approaching age 65, or if you have family members who are maybe disabled and they get Medicare early, call us, okay? Call Nick, call me. We have, we know what to help you with. We know how to help you get Medicare, et cetera. Call us 3 months prior to the month in which you turn 65, or as soon as you know that you might be eligible for Medicare due to disability or permanent kidney failure, et cetera. So we're here to help you. And if you stick with us, we'll try to keep you out of trouble. I want to give you a heads up about something. This isn't really open enrollment related, but after open enrollment, the university, the Office of the President, is going to move the servers for their current retiree database from external servers from a vendor to their own servers that UC owns. So this is going to require a blackout period for UC Raise. You won't be able to use the UC Raise portal between December 15th and the 1st of the year. It'll reopen on January 2nd. But, just try not to need UC Raise at that time. We are hoping that by shifting the retiree database to UC web servers, that UC Raise may be more stable, may work a little faster. I've been doing some testing on the new database, and it seems like it's faster. So I'm hopeful that it will work better, and UC will have more control over it once it's under UC's, the servers themselves are under UC's direct control. But it does mean that you're not going to be able to use UC Raise from December 15th until January 2nd, 2024, okay? Now, that's pretty much it for open enrollment. I want to say, though, that for more information about the plans, especially if you're somebody who's facing large premium increases and it's causing you to want to reevaluate, I strongly urge you to take a look at the streaming video on our website of the UC Retiree Medical Plans presentation. This is me, my disembodied voice, explaining with slides how all the plans work. And I try to compare and contrast the plans so that you can really get to know them better. I think if you can stay awake listening to me talk about health insurance, I think it's the easiest way for you to learn about the plans. I only talk about the medical plans, not the dental or vision, but I think it's very helpful. Just go to our website, hr.ucdavis.edu/HCF, and then look for the menu, look for presentations for retirees, and you'll find streaming video I linked to YouTube.
I threw that website in the chat as well for anybody if they want to just copy it from there.
Thank you. Now, before we open it up to questions, I want to answer a question that somebody asked me to address already on this presentation. They said, hey, you need to talk about this. And I said, okay. I said I would. And that is, every year we get complaints when a dentist drops out of the Delta Dental network, okay? Every year this happens. Every year a dentist or two or three in the local area will drop out. And, for me, it feels like there's a mass exodus of dentists because I'm getting all these calls and emails and people are frustrated. But usually it's only one or two dentists. It's just that so many of my clients use the same dentist that when that dentist drops out of the network, it's kind of a big deal for our population. But I want to tell you some more about that. I'm constantly getting emails saying, hey, can you dump Delta Dental and find us another dental plan? And you've got to realize, first of all, that UCOP cannot set rates. UCOP cannot set rates between Delta Dental and dentists, okay? UC has no control over what Delta Dental pays dentists. And of course, the dentists have been complaining for years that Delta doesn't keep up with inflation. I've been hearing that from my own dentist for many years. So UC can't control what Delta pays dentists, but we can shop around for other dental plans. And UC does do that every 3 to 5 years. UC does a request for proposal and, shops around for other dental plans. And every year, Delta Dental wins because it has no real competition. Every time that UC has gone out to bid with other dental plans, if we were to switch to one of those dental plans, we wouldn't gain dentists. We would lose dentists, like a lot of dentists, at least 13%, depending on the plan, more like 30%. We would hemorrhage dentists if we changed to another dental plan. So yes, UC is aware that dentists are occasionally dropping out of the network. But when we ask Delta Dental about that, they point out to us that, well, throughout the state of California, we've actually added 0.2% dentists. Sure, there are dentists that are leaving in certain locations, but we're adding other dentists at the same time. So there really isn't, in this area, a huge problem with access to dentists. But I'll tell you, if you are in the Santa Barbara, San Francisco, or Santa Cruz areas, they've lost a lot of dentists, and it's becoming a problem. It's becoming difficult to find Delta dentists that are accepting new patients in those areas. Here in the Davis, Sacramento area, if you're in Davis, you have, I think, 20 something, I think approaching 30 other dentists that you could choose. If you're in the Sacramento area, I think you have hundreds of Delta dentists that you could choose. We still have a lot of dentists here. So remember, if you have Delta Dental PPO and your dentist drops out of the network, they do that so they can charge anything they want. If they don't have a contract with Delta Dental, they can charge anything they like, because that contract protects both Delta and you when you use a Delta dentist. So you might shop around for other dentists. Now, there are two types of Delta dentists that you can use. You can either use Delta Dental Premier or Delta Dental PPO dentists. And those dentists, both styles of dentists, will contract with Delta Dental. They'll bill Delta Dental. There are contract rates that protect you, etc. There's a difference, though, between those two networks. If you use a Delta Dental Premier dentist, Delta will pay out a maximum of $1,500 per person per year. If you use a Delta Dental PPO dentist, then Delta will pay out up to $1,700 a year. They're encouraging you to use the Delta Dental PPO dentist because Delta Dental PPO network dentists have lower contract rates with Delta Dental. Those dentists cost Delta less. So Delta wants you to use those dentists rather than the Premier dentists. Premier dentists tend to have more experience. They command higher rates with Delta Dental. So Delta Dental pays them a little bit, pays out a little bit less to Premier dentists as a way to encourage you to use the less expensive Delta Dental PPO dentists. Either way, if you need to shop around for a new dentist because your dentist has left the network, you go to deltadentalins.com. deltadentalins.com, and you can search, you can use the filter and you can search for Delta Dental PPO and Delta Dental Premier dentists. Okay, so there's a big question. I hope I answered some. I have a feeling some of you were going to ask me about that. So I'll take some additional questions. Fire away.
So we got a few hands up. So let's try to see if Candace, I'm going to give you the permission to talk if you still have a question for us. Candace, you there? Okay. What about Gary Willett?
I'm here, but I don't have a question.
Okay, your hand was up. Okay, so I'll take that down. Shirley Toy, are you there?
Yes.
What was your question, Shirley?
Oh, I just, if you turn 65 next year, then do we just pay the non-Medicare rate for the months before you turn Medicare?
Yes, you would continue with the non-Medicare plan until you get Medicare, and then we upgrade you. So be sure to call me 3 months before the month in which you turn 65.
So if I turn 65 in February, I should have already called you, or is this month the time I call you?
Yes, you should have already called me.
Oh, I'm sorry.
That's okay. That's okay. It's just, I have almost 50 unheard voicemails right now. I'm very behind on voicemail, but I will catch up if you call me and leave me a message.
Okay, thank you.
You bet. Thanks for your patience.
Okay. Shirley Newman, do you still have a question? Okay, we'll keep going. Ross Thompson.
Yes, so thank you, Guerren, for doing this. It's always good to hear you talk about this. It's a little bit annoying that we are getting dinged with increased healthcare premiums this year for pandemic-related use, whereas apparently there weren't premium declines in the pandemic years when people weren't doing healthcare. But I guess the question I really wanted to ask was, there's always a concern about UCOP's commitment to continuing to support retiree premiums. There's no indication that, from what you've said, that any of these rate increases has anything to do with changes in the university's contribution to retiree premiums. Is that correct? And do you anticipate that continuing, at least as far as your crystal ball will take you?
First of all, I have heard nothing about UC not contributing to retiree coverage. I mean, that would be a big deal. If UC stopped contributing to UC retiree health coverage, UC would have to pay employees more, and they definitely don't want to do that. I've heard nothing about any changes to the UC contribution toward medical and dental, with the exception of, this is the first year I've ever heard UCOP say, okay, the rates were so bad this year that we threw in additional money on top of our normal budget. They added an additional $9 million to what they budget for UC retiree health coverage. I don't remember ever hearing that before. So that was unusual and welcome, of course. But even with that extra $9 million for some of these plans, the rate increases are horrific. As far as the premiums not going down during the pandemic, some of the premiums did go down. But honestly, that's really true of PPO plans, especially in general. You'll see them seesaw up and down over the years. So I am really, really hoping that this is an overcorrection, that they're playing catch up now. They'll catch up and the premiums will come back down in future years. We see, it's not true that all the premiums go up every year. The premiums do go down. This year, they're going down for the UC Medicare PPO plan. I thought they went down last year also for that plan. But we'll just have to see how it pans out. But there were some premiums that went down during the pandemic because fewer providers were being used. Of course, a lot of that was offset by new costs because plans were mandated to cover COVID tests and, things that hadn't even come up before. But I think some of the plans did go down. But that was a great question. Thanks for asking.
Well, thank you.
Okay, so Guerren, we're going to jump into some of these questions. Everybody starts to, I think we have a lot of questions to get through and people are raising their hands. So I'm going to go to some of these questions. Let's see. I'm a retiree with dental and vision coverage, but don't understand from my paycheck what it costs. My statement only shows Part B reimbursement. Also, when I went to UC site, I didn't see anything about dental and vision. Please advise where evidence of this coverage and cost. So I can answer part of that. Your vision plan, and Guerren, you can jump in, is not deducted from your pension check. That's something that you have to do on your own, even though you still get a good rate as a retiree. So I'll let Guerren take the rest.
With Vision Service Plan, you're paying VSP directly. So you see whether you have VSP when you sign into UC Rays, but you should see medical, dental, and legal on UC Rays when you sign in. And if you sign into UC Rays during open enrollment and you play around with the open enrollment tool, that should tell you your current and future rates for those plans. But one thing that confuses people about the premiums when they're trying to figure out who's paying what, the direct deposit statements for retirees are very poorly formatted. So it makes it hard to tell who's paying for what because all the UC contributions and premium deductions, they're all lumped into the same box. So here's a tip for you. When you're looking at your direct deposit statements, if it says Med ER Preem, MED means medical plan. ER means employer, that's UC. ER means employer. Preem means premium, PREM, premium. Med ER premium, that's what UC is paying towards your medical plan. If it says DEN, DEN is in dental ER premium, that's what UC is paying for your dental plan. If it says MBR, MBR means member, that means you. So if you see something that says Med or DEN, MBR premium, that means member premium, that's the amount that you're actually paying. So I hope that, I wish there was a little key on there that could explain it, but hopefully that will help you interpret your direct deposit statements.
Okay, so let's see, where was I? So thank you for this presentation. I will be staying with UC Medicare Choice, United Healthcare. To clarify, I will not be paying a premium per month, but my refund will decrease by $63.12, correct?
Well, that's correct. If you get 100% of the UC contribution, then you're not paying anything next year. You're not paying anything this year, but your Medicare Part B reimbursement, that credit on your pension check that people only get if they have Medicare and they get enough of the UC contribution and they choose the least expensive medical plans, that Medicare Part B reimbursement is going down for people in the UC Medicare Choice plan.
Okay, here's one about reporting a death. And so when you're reporting a death, there's a survivor number to call at the RASC. The Retiree Center can only put it in a system that's their that we have a little bit of access to for a death. But if you want to call me at 530-219-9346, I can give you that phone number. I don't have it up at the moment. So reporting a death should go directly to RASC, and they have a survivor unit. So it's actually good to do it with them to establish some connection with that unit. And I will say they've been doing a really good job. So if you want to go ahead and just call me, I can give you that phone number.
Also, if I can jump in, sorry, I also put in the chat a PDF with a checklist for reporting death and things that you need to do. So you might find that helpful as well. It's in the chat.
Thanks, Nick.
Also, if you call the just general RASC number, 800-888-UCOP, the same number we've been talking about, I believe option 3 is survivors and death reporting. So you don't actually need to know the separate number. You can just call the standard number, just choose the right option.
And Larry put the survivor number in the chat as well for everybody. So let's, will the reimbursement amount for Medicare change in 2024 if all are enrolled in Medicare?
Yes.
Okay, I like this.
Reimbursement is going down if you have the UC Medicare Choice Plan. It's going up a little, just a little bit if you have Kaiser Senior Advantage.
So in a nutshell, what is the difference between UC High Options, Anthem Blue Cross, and Anthem Blue Cross PPO? In a nutshell.
So if you're comparing the UC High Option plan with the UC Medicare PPO plan, both plans are very similar. They are both plans where you have Medicare paying first, Blue Cross paying second. High Option is more expensive because you have Anthem paying 100% after Medicare. So Medicare pays first, Anthem pays the rest, you pay 0 for almost all medical care. I mean, that's, you know, the richest benefit you could have. That's why it's the most expensive plan. Medicare pays first, Anthem pays the rest, you pay 0, whether you go to the doctor, whether you're hospitalized, etc. With the UC Medicare PPO plan, you have a lower premium because Anthem is paying 80% after Medicare. So that means you will have something to pay for medical care when you have the UC Medicare PPO plan, because Medicare pays first, Medicare pays 80% or better. That leaves 20% or less left over that then goes to Anthem. Anthem pays 80% of that 80% of that 20% or less, leaving you to pay 4% or less of the Medicare allowable for that charge. So people that have the UC Medicare PPO plan, they have to keep track of medical bills. High Option members don't, but Medicare PPO members will be billed eventually. You might go to the doctor. Somebody showed me a medical bill that they received under that plan. They went to the doctor 3 months later, they got a bill for $3.23. Or you might see a bill for $11 or $6, all these weird little bills. One person told me that they had a $170,000 surgery under the UC Medicare PPO. Their out-of-pocket was less than $300. And that's because you're paying 4% or less of the Medicare allowable. And even if your 4% was 4% of a bazillion dollars, remember, the plan has a $1,500 out-of-pocket maximum. So when you're comparing the premiums between the High Option plan and the UC Medicare PPO plan, the difference in premium is huge. It's more than $200. It's more than $200 more to be in High Option than it is to be in the UC Medicare PPO plan. So you're going to spend more than your worst case scenario under the UC Medicare PPO just in premium, because the difference in premium between the two plans is more than you're risking under the UC Medicare PPO of $1,500. But that's just talking about medical benefits. The other big difference between High Option and the Medicare PPO is that High Option, the more expensive plan, has a $1,000 cap on what you pay for prescription drugs, which makes it the richest pharmacy benefit and the richest medical benefit across all of our plans. All the other plans have out-of-pocket maximums for prescription drugs that are higher. So High Option is popular with people who are rich, who are horribly ill and don't want to keep track of medical bills, people who are busy and don't want to keep track of medical bills, and it's popular with people that take fistfuls of medication, because even though the co-payments are low for drugs under the the plans. Under the high option plan, if you take a lot of medications, like 10 or more per day, you might hit that $1,000 out-of-pocket maximum and be advantaged in that way. So those are the differences. Mainly the premium, Anthem paying 80% versus 100% after Medicare, and the out-of-pocket maximum for prescription drugs. Those are the only differences between those plans.
Hey, just a reminder, this is being recorded, and we'll get it edited and put up on the website Retiree Center at ucdavis.edu. We'll have it up by Friday at the very latest, but hopefully it'll be up by tomorrow afternoon. So you can look at it, Retiree Center at ucdavis.edu. We'll make it pretty prominent on the first page. So let's see. I had one quick question, and I don't know if you'll know, you probably do know this. Do all of the plans for retirees have coverage for hearing aids?
No, there is one plan that we offer that does not cover hearing aids, and that's CORE. C-O-R-E. CORE Medical does not cover hearing aids. All the other plans cover hearing aids. Your strongest hearing aid benefits are going to be under the Anthem Medicare plans. The high option and the UC Medicare PPO plans have spectacular hearing aid coverage without an artificial maximum. All the other plans have limits of maybe $2,000 towards what they'll pay for hearing aids. So it's high option and the Medicare PPO have very good hearing aid benefits. You want to use Anthem preferred hearing aid dispensers like UC Davis Audiology or Delta Hearing. Kaiser Senior Advantage also has good hearing aid coverage, but they top out at $2,500 per aid per ear. That's a $5,000 limit on what they'll pay for hearing aids, which is not quite as nice as the Blue Cross plans, but it's still very nice. The other plans tend to have $2,000 caps on what you'll pay.
Okay, so let's see. If currently have UC Blue and Gold HMO and husband turning 65 in August 2024, should I consider a change to another medical insurance?
Well, I mean, to me, those are totally unrelated things. You can either shop around for different medical plans during open enrollment, or you can coordinate Medicare with whatever you have. You can try to strategically place yourself in the plan that gets you into the Medicare plan that you want ultimately, but it's much easier just to roll with the punches, meaning consider those things separately. Shop around for medical plans based on your current situation. Call me 3 months prior to your spouse turning 65. Any plan that you choose, any plan that you're in, the Medicare version is going to be better and cheaper unless you're super high income and have to pay high income premiums for Medicare. It doesn't really matter what you pick because the plan will convert for the person who gets Medicare. It will be upgraded to something that is better than it was before. So that's why I don't worry too much about trying to place myself into a plan strategically based on some future Medicare enrollment. All the Medicare plans are better than the non-Medicare plans, so you're going to win either way. It's easier to shop around during the open enrollment after the Medicare coordination is done, in my opinion.
Okay. So, wow. Let me go back up to the top here.
That's 99 plus in the Q&A. So
I know.
We're doing that.
So there was a question about comparing the different insurance plans available. And I thought I seen that in my insurance booklet. That's part of the retirees as well, isn't it?
No,
It's not.
The actual plan comparisons are not in the open enrollment booklets because the open enrollment booklets just communicate what's changing. And this year, it's pretty much just the rates are changing. There's no other information. So if you want to compare the plans, I would encourage you to go to my website and go to my UC retiree medical plans presentation where I will walk you through the differences. But there's another place, another way to do it. I link to it in my retiree presentations page, but the UCNet Open Enrollment site will also link to PDF documents called Which Medical Plan is Right for Me and Which Medicare Plan is Right for Me. The Which Medical Plan or Which Medicare Plan is Right for Me documents are the publications that UCLP has put together that compare the plans side by side. So if you're looking for a side-by-side, quick and easy comparison, look for those documents. They're PDF documents. You should find them easily.
Should a July 1st, 2023 retiree sign up for VSP during open enrollment this year?
Okay, if I heard you correctly, you're talking about somebody who will be retired in the future. If they're
retired this past July.
Okay. Yeah, so if you want coverage through Vision Service Plan and you haven't already set up a payment schedule with VSP, then open enrollment is your opportunity to get UC retiree VSP. Give them a call or use the website that's in the black and white booklet that you should have gotten in your open enrollment mailing. My impression is that most people just pay their entire year's premiums all at once because VSP isn't very expensive.
And so just to reiterate, I know for employees, if we're not making any changes, we don't have to do anything. And the same is being asked as a retiree. If they're not making any changes, they don't need to do anything. It'll just roll over into the next year, 2025.
That's right. If you like what you have, do nothing.
Let's see. So my spouse and I are both UC retirees. I just retired in July and currently are both enrolled through me. Can we mix and match? In other words, can each of us enroll individually in healthcare, but enroll both of us under one spouse's dental care?
Yes, as long as you're not double covered, you can, we call it bundling and unbundling. You're bundled if one retiree is covering both spouses. You're unbundled if each retiree is covering their own thing. Well, that could be strategically advantageous if one of you is eligible for less of the UC contribution than the other. You want the person who gets the higher percentage of the UC contribution to carry the insurance so that you as a family pay a lower premium. But if both of you are eligible for the same level of contribution, it's more of an advantage to be unbundled and separate, because if one of you passes away, then you don't have to do anything with the health insurance. You're already covered under your own record.
So a plan like Kaiser Senior Advantage states that dental and vision are included. Where I carry separate dental insurance, is that necessary? I think there's some confusion on that.
Yes. So if you see Kaiser offering dental coverage, I mean, lots of Medicare Advantage plans out there that you'll see on billboards, you'll hear on the radio, you'll see on TV ads, just relentlessly advertising Medicare Advantage plans. These Advantage plans that are outside UC, right? Our Kaiser Senior Advantage does not include dental. We have separate dental through Delta Dental. We don't mess with Kaiser's dental, right? But if you're seeing solicitations out there, you're going to see all kinds of Medicare Advantage plans try to get you to sign up with their plan, because if you do, they get something like $1,000 a month from Medicare. So they're going to throw in free fitness clubs. They're going to throw in, dental coverage and, a little bit of hearing aid coverage and things like that. They're going to do anything they can do to get your attention because they want your Medicare. But remember, if it doesn't say University of California, then it's irrelevant to you, because the coverage that you can get through UC is better than those off-the-shelf plans you see advertised. Be very wary of any insurance brokers that call you or try to sell you things. We have had multiple, not a lot, but a handful of retirees who fell for a sales pitch and accidentally signed over their Medicare to a non-UC plan. Believe me, they regretted it.
So We have Kaiser Senior Advantage. Kaiser says we don't have over-the-counter coverage. Is this true? So over-the-counter medications?
I mean, I don't know of a medical plan that covers over-the-counter medications, so I think that's true.
Yeah. Is there any enhancement for Medicare like vision added?
No, vision is separate. Medicare doesn't pay for glasses unless you have cataract surgery, which is a rare exception. Medicare doesn't pay for teeth. You know, when you see these Medicare Advantage plans advertising free fitness clubs and dental and hearing aids and all that, it's just a solicitation. They're trying to get you to give them your Medicare. And if you do that and it's outside UC, then you're going to lose your UC coverage. So beware.
So I think a couple of people say they were having trouble with UC Rays signing in. If you call 800-888-8267 and do option 1, there are people there that will assist you with your logging in. If you don't have any success with that, you can also call us at the Retiree Center. We can't get in for you, but sometimes we can just help you sort of walk through the process. But you should call the RASC at 800-888-8267, and it's option 1. And this option 1 is specific to help you with logging into your UC Rays. So with the decrease in Anthem premiums, are there any losses in benefits? In other words, are we getting less?
No, that's easy. No, there's no change. There's almost no change at all to the medical plans, except for the premiums.
That's awesome. Can I use my HSA funds if I change to core?
You can use them. Yes, that's your money. But be aware that if you switch to core, that is not a HSA compatible plan under IRS rules. We definitely had that plan analyzed, and it doesn't fit the IRS requirements. So you will no longer be able to contribute to your HSA. So if you go from the UC Health Savings Plan to core, be aware that whatever you have in the HSA, you can still spend. It's your money. But because UC will no longer be paying health equity is the banker, if you will, for the HSA. They're like our Fidelity for HSA monies. Health equity will deduct your HSA $3.95 a month to fund their own operations, since UC won't be paying them to manage your HSA money. So if you're going to be in that situation and you switch to core, you can either spend your HSA down to 0 to avoid paying that $3.95 charge, or you can make other payment arrangements, you know, call Health Equity up, see what minimum balance they might require before waiving that fee. Or you could roll the money over to your own HSA at your own bank, or through your own Fidelity account or something like that. Whatever gets you the best rate on managing that money.
Okay. So is United Healthcare Choice and Medicare Part D double coverage? Can I drop? Okay.
Yeah. Medicare Part D, as in drugs, is part of all of our plans for Medicare. You know, if you have Medicare, you have Part D, as in drugs, even if you're not aware of it. Medicare Part D is subsidizing your drug coverage. The only exception to that is the UC Medicare PPO that doesn't cover drugs, which is by design for people who are triple covered, so that they can be triple covered for medical and get their Medicare drug coverage elsewhere. By the way, you know you have Medicare Part D if you look at your ID card from your medical plan and it says Medicare RX on it. That means you have Medicare Part D.
Some of these I know we've answered. I'm just trying to get them out of here. So this one is, it's UC Care PPO for him, or the retiree wife and adult disabled daughter. They want to continue with it. None of them have Medicare. Our disabled daughter has Medi-Cal. Is it true that we need to inform Anthem that we do not have Medicare through Accolade in the past, if we did not inform them, then they stopped paying.
Okay, so PPO plans a lot of times won't pay medical claims each year until you tell them whether you have other coverage. And they would usually send you a questionnaire or that sort of thing. So, you know, you might be asked, do you have Medicare? Do you have other coverage? And if you are asked about that stuff, you should answer. You shouldn't ignore it. You should call the medical plan. You should tell them, yeah, I don't have Medicare, that kind of thing. But they're probably not going to ask you about Medicare until you're at least age 65, because most people don't get Medicare until they're 65. But they still might, but they don't know what you might be eligible for, because you might have a job someplace, or your spouse might have a job someplace that's covering you. So they have to ask. So definitely, you know, reach out to them and answer their questions every year. As for your daughter that has Medi-Cal, I think they will want to know that they have Medi-Cal, but Medi-Cal pays last. So it's not super important because your UC medical plan has to pay first before Medi-Cal pays for that daughter. The only other thing I could add is that if I was in UC Care, I would seriously consider the core plan as an alternate.
So United Healthcare goes up $63 per month. Is that for one? What is the increase for husband and wife?
Double that then if it's for somebody who's 100%, who's eligible for 100% of the UC contribution, and it's a couple, a retired couple where both have Medicare, then the increase of $63, double that. It's, you know, 126 or whatever it would be.
So there's a quick question, and this is not healthcare, but it says, what about coverage for legal services? I didn't see that went up. I don't have it, but did you?
ARAG Legal, ARAG, is a German company, and they pronounce their acronym ARAG, not ARAG, ARAG. That's how they say it. But anyway, if you want ARAG Legal, you can sign up during open enrollment. I don't think the rates are going up for that plan. I am not an expert on the legal plan. I specialize in the health plans. So this isn't my area, but I will throw out that the ARAG legal plan does something I really like, and that is it provides $1 million worth of identity theft protection, and it does identity theft monitoring. But you have to belong to the plan and pay for it. You also have to sign into a special website, the ARAG identity theft website, and tell them what to monitor. So they're monitoring my credit cards, my social security number, my phone number, my email address, my passport number, credit cards, etc. And if anything fishy is out there, they let me know. And I have been informed that my social security number is for sale on the dark web. I know that because of ARAG Legal.
If you become Medicare eligible during 2024, will your premiums change or remain the same until January 2025?
So Medicare coordination is done when you get Medicare. And when you do that Medicare coordination, it will always result, well, almost always result in you having a lower UC premium. But most people, I would say, save money as soon as they get Medicare, unless you're high income. If you're super high income, then you pay more for Medicare that may offset savings through UC. And there are also some situations where you might end up paying more because your coverage is better. Like, for example, if you have core and you have a zero premium, and then July 1st you get Medicare, we're going to upgrade you to the UC Medicare PPO. So you're going from a plan that has a $3,000 deductible to a plan that almost never has a deductible. You're going from catastrophic coverage to spectacular coverage, and you would have an increase in premium there. But most people save money as soon as they get Medicare.
So I currently have UC Medicare Choice for my husband and I. No complaints. Should I consider another plan for 2024?
Well, I mean, all of our plans are nice if you have Medicare and you're retired. I mean, my retirees with Medicare have better coverage than I do, right? But I would say that, you know, if you're happy, then you don't have to do anything. But I will say that one of the strengths of the Anthem plans, the UC High Option and the UC Medicare PPO plans, the major strengths of those plans is that you get to keep your Medicare with those plans. They are not Advantage plans. So you have access to more doctors because those doctors don't have to get permission to treat you. Okay. And that's because if Medicare is paying first, 99% of the doctors are Medicare. You know, something like 90% belong to private insurance, or 94%. But 99% of US doctors are part of Medicare. So if you have Medicare as your primary, you have maximum access to doctors. And more doctors belong to Medicare than belong to private insurance because Medicare only requires prior authorization for certain things, like certain durable medical equipment, certain infusions, and in Medicare Part D will require prior authorization for some prescription drugs. But for everything else, if you're a Medicare doctor seeing a Medicare patient who isn't in an Advantage plan, you control the healthcare. Those doctors control the healthcare without having to get permission from some panel of doctors at a private insurance company who have never seen the patient. You know, these plans that require prior authorization, they can, you know, kick you out of the hospital before your doctors think is appropriate, or they can deny your MRI or your proton beam therapy. You don't have to deal with that when you have Medicare as your primary. So that's the principal advantage of having, you know, a Medicare supplement plan as opposed to the United Healthcare plan, because the United Healthcare plan is an Advantage plan, meaning if you have a Medicare Advantage plan, you got to sign your Medicare over to a private insurance company. You don't get to keep your Medicare with that plan.
So this is a good one because we talk about moving out of state at a lot of our programming throughout the year. So this person is saying, we live in California and have Kaiser Senior Advantage. Since Kaiser is also in Washington, could we continue with Kaiser Senior Advantage if we moved our permanent address to Washington?
So if you change your home address and you're retired, if you change your home address to something that's outside California, if all covered family members are age 65 or older, and they all have Medicare, you're not covering any non-Medicare family members, then UC won't let you keep our custom Kaiser Senior Advantage or other UC retiree medical plan. UC covers people out of state when everybody has Medicare and everybody's 65 by sending you to a giant insurance broker called Via Benefits. Via Benefits sells the same plans that anybody with Medicare could buy in other states. So it's not custom coverage the way you have it now. So the plans aren't as nice. So, but UC will help you pay for it. And UC provides this broker called Via Benefits. So if you were to change your home address to something that's outside California, like Washington, if you happen to be in the Kaiser Senior Advantage service area in Washington or Oregon or Washington, D.C., I don't know which one you're talking about, but either way, it's the same answer. Kaiser does not allow brokers to sell Kaiser. Only Kaiser sells Kaiser. But one of the reasons that UC offers Via Benefits is to let people in these other Kaiser service areas sign up for Kaiser. Kaiser's in little pockets here and there around the country. We don't contract with Kaiser other than in Northern and Southern California. So Via Benefits is a way for our retirees with Medicare to get access to Kaiser Senior Advantage in Washington, D.C., and, you know, Washington, Oregon, Georgia, Hawaii, Colorado, all these other little pockets where Kaiser exists. But be aware, it is not the UC Kaiser Senior Advantage that you'd be getting in Washington. You won't have a $1,500 out-of-pocket maximum like you do through UC. Your copayments may be higher. Your premiums could be higher. You know, some of the really nice things about our custom Kaiser Senior Advantage, they will not be the same when you just buy the off-the-shelf product that anybody can buy in Washington. So be aware of that.
So just to let everybody know that's on here, one of our participants called the RASC and they said that the site isn't working, and somebody else had mentioned that in one of the questions too. So I think if you're going to try to reach the RASC, you might want to try a little bit later. Sounds like they're having some system issues, and I'm hoping that they get that resolved soon. I think our phones are going to be blowing up as well because of this, but you guys got an advance warning that try RASC either later today or tomorrow. And it doesn't surprise me that this happened. So they're probably getting bombarded with questions. All right, so.
I'm in that I didn't try signing into UC Raise today, but I tried to sign in to the database that I have access to that is a link. It's essentially my window to the retiree database, and it hasn't worked all morning. I reported that to the tech people first thing this morning, and I know that they're working on it. So yeah, maybe try again later this afternoon.
Okay, so we've got quite a few of these. My husband will turn 65 on 12/19/24. Do I need to change my plan?
I mean, again, to me, Medicare coordination is totally separate. If you want to shop around and change plans, you can do that during open enrollment. But Medicare coordination just means that you need to do something. Call me in, what would it be? September, October, November. Yeah, call me in early September, and I will make sure that your spouse knows how to sign up for Medicare and that you know what to do to coordinate Medicare with the UC coverage. And your spouse who gets Medicare will be upgraded while you remain in the same coverage you had before. Medicare coordination is done mid-year, regardless of open enrollment.
So are there any changes to the out-of-state VIA benefits? There was a couple questions.
Change that is hopefully irrelevant to people in VIA benefits. And that is because of the Inflation Reduction Act removing some of the costs to people in real world coverage. Like I said, they're getting rid of the 5% to infinity that people like my mom would pay if they had regular real world Medicare plans. Historically, UC has paid VIA benefits to reimburse our retirees who have VIA benefits for catastrophic prescription drug costs. UC is ending that program because Medicare Part D is getting better. And I guess the idea is that we don't need to be offering this catastrophic coverage special payments program because people won't have the crazy high catastrophic costs in the real world drug plans because Medicare Part D, as in drugs, is being so improved by the Inflation Reduction Act. But that's the only difference. That if what you're trying to find out is the amount that UC will put into the health reimbursement arrangement, is that going up? No. UC has never increased that amount. They analyze it, and then they come up with reasons not to increase it.
So my daughter, who is insured under my plan, is moving to Spain for about 2 years. In January, she will have a job with medical coverage. Should I drop her during open enrollment or wait until February 2024 and make sure she has insurance in Spain? If I drop her, can I add her to my plan anytime when she returns to the US?
So definitely, if you take somebody off your plan and you need to put them back on when they lose other coverage, as long as she's under age 26, you could add the daughter back to your coverage if you could prove the involuntary loss of other coverage, if you used open enrollment, or if you missed an enrollment period like open enrollment, if you were willing to wait 90 days. UC will make you wait 90 days for medical coverage if you enroll and you don't have justification for enrolling at that time. For example, if you were to get married but fail to add your spouse within 31 days of the marriage, the RASC would make you wait until the 91st day before they would cover your new spouse. So that kind of rule will apply. So yeah, you could take your spouse off, your child off. Should you take your child off your medical coverage? Well, I mean, that's up to you. We don't make it that expensive to cover children. You don't know if something will change in her circumstances and she might come back to the US and might need coverage. But if she's covered by core or UC care, then she has comprehensive worldwide coverage. If she's covered by any other of our plans, she has at least emergency coverage outside the United States. I don't know if that would be useful to her or not, but if you decide to save yourself a few bucks and take her off, you could always put her back on during open enrollment or mid-year if you can prove that she's losing other coverage involuntarily, or using that 90-day delayed option that I mentioned.
Okay. So, Guerren and Nick, do you want to give your phone numbers right now?
Sure.
I'm getting a few requests for your phone numbers, and just as a reminder, they prefer to talk on the phone. Emails seem to that's a little tougher for them, but whatever you'd like to do.
Yeah, if you're going to email us, that's fine. But we tend to be farther behind on email because when we send email to employees, we don't send email to retirees. But if we send email to employees, it goes to 23,000 email addresses. So as a consequence, we get a lot of email, and email is not interactive enough. There are way too many variables to be able to answer people's questions around healthcare. There are way too many variables to make email easy. So phone is always the best way to reach us. Our phone numbers are definitely on our website, which you can see right by my name, right by my talking head on your Zoom right now. If you go there and click on Contact Your HCF, you'll find our phone numbers, but you'll also find a detailed contact sheet with all the details that you might need to reach us. But my phone number is 530-752-4264. Well, maybe Nick can throw our phone numbers in the chat.
Yep, I'll do that right now.
So I think this just needs to be reiterated. And how much does my retirement plan at UCD pay for Medicare? I think there's a little confusion about that.
No, UC has no way to pay your Medicare premiums. Your Medicare premiums are between you and Social Security. However, if you choose a particularly inexpensive medical plan and you have Medicare, you might get Medicare Part B reimbursement from UC. UC, if there's any money left over after UC pays a Medicare plan's premium, UC adds that money that's left over to your UC pension check, since we require you to pay for Medicare. So since you're required to pay for Medicare, if there's any money left, we add it to your pension check to reimburse you for Medicare Part B. It's a reimbursement that's not taxable. But again, you're only going to get Medicare Part B reimbursement if you choose the least expensive medical plans.
Okay. So we couldn't get to all the questions, but I do think after reading through them, Guerren's touched on just about everything. And once again, you can go to the UC Davis Healthcare Facilitator website and print out those booklets. They are there. It's very easy to find. Once you get there, just scroll down. He and Nick have everything laid out very nice and easy to follow on their website. Also, you can find it on UCNet, which is another place to look. But I'm going to, as you know, we are at 11:26, and I would just want to say a huge thanks to Guerren, because I know there's a lot of questions, but so much information was relayed, and hopefully we put a lot of people's minds at ease for this open enrollment. Nick and Guerren's numbers are in the chat for you all. And if you need them, you can always call the Retiree Center at 530-752-5182, and we can give you their phone numbers as well. So I think without further ado, I just want to say a huge thanks to Guerren and Nick, Larry and Amanda, and for all of you that attended today. This was a great session, and hope everything goes smoothly for everybody through open enrollment. And we'll see you soon. Thank you.
Thank you, Jim.